Nurses of Reddit, what is your funniest emergency room story? Not my story, but heard it from my cousin. She was training for her nurse diploma at the time at a local hospital. So there is this old guy, 70 to 80, coming in the year with a big wound on his leg, and he had to go for surgery. My cousin tried to prepare him for the surgery and asked him to remove his boots and clothes so he can change into proper clothing. The old guy started yelling and cursing because he didn't want to get his boots off. Several doctors came by to calm him, and he started to fight them too. After some time, when he calmed down, they injected him some anesthetic in order to remove his boots without him flipping over. It turns out he was ashamed to take them off because he had his nails painted red. Happened to my dad, however it was his fingernails that were painted. He would work nights and watch us girls, 4 of us, during the day, while my mom worked. Well, when he fell asleep we got purple nail polish and painted his nails. Since he was / a Vikings fan, he ends up waking up late for work and rushes out of the house. He didn't notice his nails being painted since it was dark out. He had a meeting with his supervisors also that night, so he walked in and sat down with his hands on the table. He said that each one of his supervisors looked confused and were just staring at his hands. It's also something to mention that my dad was in the Marines and is very manly. He said he looked down, chuckled and said "Go Vikes" with the most serious face. No one said anything about it after and just continued the meeting. I used to work in the air sometimes, and when we would pull stuff out of people's buttholes it would get washed and sterilized and put in this box under the fridge desk. When a new person started we would run a pull on who could get the newbie to use something out of the box first. I won it once by taking the staples out of his stapler and then casually mentioning that hey, there is a stapler in the box under the fridge desk. I won $150 that day. But in MA and I once had a patient that was a Catholic priest that developed a skin rash. He was treating it with that spray Clorox cleanup solution, which of course only made it worse. When asked about the rash, he said he caught it from his wife and then pleaded with us not to report him to the head guy at his church since he's not supposed to be married. Obviously we can't report things like that due to privacy laws. Turns out his wife was a hooker that was also one of our patients, unbeknownst to either of them. FYI/Clorox spray, when applied liberally and directly to your genitalia, will cause burns. What an idiot. Fucking patient. But here are some stories. The patient had a UT. She told me that a previous nurse had told her to wipe front to back, and how ridiculous that was, as she had wiped back to front her whole life and was fine. I asked her if she had ever had a UT before. She said oh yeah, all the time. Had a patient who was coming down off of meth. He insisted that he had been kidnapped because a hold had been placed for very valid concerns about violent behavior. He called 911 and said he had been kidnapped. The police arrived to make sure everything was alright, make sure that someone hadn't actually been kidnapped. When the patient saw the police's response was not "I have been kidnapped, please help," but to try and attack the police. We managed to disengage him without anyone getting hurt. As soon as they left he demanded to use the phone to report his kidnapping. Or that time a nice fella taking a colonoscopy prep overdid it and got to vomiting just when the diarrhea kicked in. Eventually, exhausted and empty, but feeling better, he thought he'd try to get approved to go ahead with the colonoscopy instead of wasting the prep. GI said okay if he went to the ED and got checked out for dehydration infection. He hopped into the shower, cleaned off in a hurry, and came to see me, having failed to notice that he used his teenage daughter's fancy silly glitter body wash. This big, macho, muscular, conservative-looking 50-year-old man, glittering like Edward from Twilight. Once he heard the workup was okay, and he was clear for the scope, we all had a great laugh. My mom has been a nurse for my entire life, and I remember when she did her stint in the or at our local hospital. She told me some guy came in complaining of pain in his ass, but would not specify to the female nurses what happened. Being that the or was a zoo, they implored the man to be honest, just because they didn't have many men working on the floor, and since he was not in crisis he may have to sit for a while. Finally the man broke down and told them he was home watching some adult films. This was the early 90s when he got curious about a certain thing he saw a male performer do, but unlike the professionals this guy couldn't get it out and it was currently stuck in limbo. My mom never specified what was shoved up his anus, but she said he got lucky they were able to get out completely. My ex was a nurse and she once attended an emergency surgery of a guy who had been stabbed with a spork, the spoon terminus, mind you, and the instrument was still stuck in his chest when he arrived at the hospital. For some reason, on the fork side of the spork there was a little piece of wienerwurst attached. The surgeon's hand trembled from laughter during the whole operation. When asked during recovery about what happened, the guy said he'd slipped while eating dinner and fell on the spork, but the authorities suspect there was something more sinister going on. We had a dad bring his kid in, cause she had weird red areas on her belly. He screamed at us, cursed and made a big scene, claiming his kid would fade into unconsciousness and we are just watching her die. Don't get me wrong. If she'd had altered mental status I'd have been concerned, but the kid was dancing around the examination room and had no signs of problems whatsoever, while we had actually sick kids waiting. Well, dad insisted to get an ultrasound for his kid with internal bleeding. When the ultrasound gel was applied, we wiped off the red color that she probably got from a new shirt or toy or whatever. He was embarrassed, at least. Not sure if it counts, because it's not in the but it still makes me laugh. Student nurse here, I work in home care. I once got a call from a client who was freaking out because a friend brought her home and now her friend said she didn't feel well, to the point she wasn't responding anymore. So here I go, rushing over, thinking about the questions I need to ask, things I need to observe, possible outcomes, etc. I arrive at the client's house. My client comes running to me. Come fast, come fast. There she is. She runs to the couch and starts rubbing a pillow. Turns out she was hallucinating. Not a nurse, but I bet she told everyone, because she was cracking up at my innocence. I had the need for a poison ivy shot and my dad told me they shoot your butt in like 15. So nurse says time for your shot. Can you? Me, pants down, butt out. Pull your waistband down. The funny part is I kicked my shoes off as well. Like I was about to get all naked and comfortable for a 1-second shot. We all laughed real hard at that. She had the pants down before but never the shoes kicked off. Former medic, not a nurse. The nurse said the funny part. Bring in a bumsicle. This is MMM, 1987 or so. This is way before medics were allowed to use warming blankets or warmed forth fluids in the field. Basically, scoop and run and deliver to her. Anyway, he was unconscious but still alive. We get him to the and one of the nurse trainees cuts his clothes off. This dude, even in the middle of a New York winter, was hung like a horse. All the men in the treatment area were either hanging their heads in shame, whistling in approval, or applauding. Gigantic dung. What do you think is wrong with him? The trainee asked. Head nurse, at that exact moment, whips the curtain back, walks in, takes the entire scene in, and without missing a beat goes. He got a harden and passed out. I had to be somewhere else, urgently, at that point. My sister works as a nurse in delivery ward. One couple wanted to name their kid a pretty interesting combination. The dad liked Sirius and the mom liked Unique. Their last name was fairly ordinary, like Smith or something, so they basically wanted to name their kid Sirius Unique Smith. One of the nurses advised they give the kid another, less creative middle name as an alternative they could use when they got older in case the kid didn't like those two names. So they decided to go with Lee and that was how my sister ended up helping deliver a baby named Sirius Lee Unique Smith. Not me but my friend is a paramedic. They had a regular who'd always have heart attacks and this time was no different, except it was much more serious. He was clinically dead for a few minutes, so she made the decision to wind down the CPR as he'd have severe brain damage at the very least. They were just about to stop when he suddenly took in a deep gasp and opened his eyes. He sat up straight and just started chatting to them. His first words, in fact, were this isn't Sainsbury's. They kept trying to get him to lie down and remain calm, but he kept joking around instead and said he was used to it. They took him to the hospital, but he refused to be stretchered in or to even use a wheelchair and just wanted a coffee. Lol. My friend was completely gobsmacked at him being brought back without any brain damage whatsoever, or even being as aware and calm as he was a complete miracle. My cousin is a nurse at a hospital that provides the medical care for a major city's inmate population. Her first week there she was going to give a prisoner some kind of vaccination. The deputy guarding the door opened it for her to find that the inmate was gone. After a little bit of sleuthing they saw the drop ceiling tiles wiggling a little bit. She said she stepped back, and 2 deputies and a police officer grabbed brooms and mops from the janitor's closet and started jabbing up into the ceiling until the escapee fell out head first onto one of the deputies. She said they both ended up with a concussion.